you know that we are again going to have a thought leadership series. Thought leadership series that crisis moments create opportunity. Problems and crises ignite our greatest creativity and thought leadership as it forces us to focus on things outside the norm. Thought leadership is fundamental in business today and consists primarily of finding and sharing great information in a way that attracts and retains. Thought leadership is when a leader's thoughts are being used by leaders to lead others. Thought leadership is influencing a narrative by understanding what needs to be done. A thought leader can be recognized as an authority in a specific field and whose expertise is sought and often rewarded. That can be an expert, a historical figure, or a wise person with worldly impact. In this series, we will be asking straight questions and we expect a straight answer from our thought leader. And today, our thought leader is going to discuss on a very, very important topic, very relevant, very hot, current topic, that is mask, which prevents Omicron. And our thought leader today guest is Professor Dr. P.P. Devan. Professor Dr. P.P. Devan is the Professor Head and Neck Surgery at AJ Medical College, Mangalore. Professor Dr. Devan is an accomplished medical doctor and an all-rounder in latest treatment advancements. He is very fast in responding to changing times and very appropriate in deriving at medical solutions. Although he is a specialized in head and neck surgery, he has effective treatment for many illnesses. His episode about self-care from COVID-19, which is done with me in media conference with Lal Goel during the first wave of the pandemic, went viral and helped many people to stay away from fear and panic caused by the virus. He kept himself updated with latest treatment protocols and helped many people to manage the crisis at ease. He was professor and head of head and neck surgery at AJ Medical College, Mangalore. He now serves AJ Medical College as professor of head and neck surgery. He was chief of medical education of AJ Medical College, Mangalore earlier. Professor Dr. P.P. Devan had won 2 gold medals for outstanding research in the South India ENT conference and was the editor-in-chief of ENT International Journal. Welcome, Professor Dr. Devan, on our show. Professor Dr. Devan, as you know, this is a thought leadership series in which I ask a straight question and I expect a straight answer from you. Some questions will be irritating because I may ask questions acting as a devil's advocate. But purpose of this show is to enlighten the public at large on such a topic which otherwise, because we know that the media is highlighting the topics, but what they are saying, what they are not saying, that is their views. But here in our media conference with Lal Goel, our endeavor is to bring the expert and take the expert's views, asking the questions and which he gives the answers as per his knowledge and his own experience. So my first question to Professor Dr. P.P. Devan is, what is Omicron?
So thank you so much for having me. We have gone through a whole lot of suffering, and it is around November of last year that a new mutant strain emerged from South Africa. And in the process of naming, they initially wondered what to name it as. And the next after Delta was a word that sounded like China, which they wanted to avoid because of the possible embarrassment. And therefore, they decided to give the word Omicron. And that has come from South Africa. South Africa immediately, in its earnestness to help and inform others, put it online, inform the world. They never foresaw what disastrous consequences this information will have, because the moment it announced, the world shut itself off from South Africa. All flights were banned, all their activity were curtailed. But unfortunately, somehow it has spread from South Africa across the world. It is so distressing. When yesterday we saw the statistics, 1 million cases of Omicron in America alone. Not COVID, of which the larger majority is Omicron.
Okay. You mentioned about South Africa. I have some figures to give. That these figures are up to 30th of December 2021. Yes. And it was published in JAMA magazine, that is of a journal of medical. It's a reputed magazine of medical world. It says that patients' median age for Delta, they have given the comparison between Delta and Omicron. In the Delta, the median age patient was 59 average age, while in Omicron, it was 36 years. So it shows that the Omicron is prevailing more in the youth or the younger people than the older people. Then acute respiratory symptoms. In Delta, it was found 91%, while in Omicron, it was found only 31%. So basically, the Omicron is not affecting. What I think, if you can just analyze this thing, I'm giving you the figure one by one. If you give your expert opinion that Delta's median age was 59, but Omicron age is only 36. What it shows according to you, Doctor?
It just shows that the Omicron variant, I don't know who designed or how it is designing itself, is now targeting a younger age group. And that is a little scary and a little confusing, because the younger age group is a little more immunologically stronger, but still it is targeting that age group and catching them.
And the worst part in India is the younger group is also going out and they have already lost their guards. They are not using the face mask, etc. So that precautions which seniors are taking, the young generation is not taking. So it's scary for them.
Yes, absolutely. So,
okay. Now about the acute respiratory symptoms, 91% in Delta, and in Omicron it is only 31%. What it means?
That means, why did this respiratory shutdown happen in the Delta variant? It evoked a far more powerful, what is called a cytokine storm by the immunomodulators, and that forced thick mucus secretions into the lung and shut it down. Whereas that seems not to be the case in the newer Omicron variant. That very powerful immune response shutting down the lungs seems not to happen. So that's a little sort of positive thing in that regard.
So you mean to say that this Omicron is not affecting the lungs as the Delta used to affect on our lungs?
Right. You are absolutely right.
Okay. Now, duration of hospitalization, according to this research data, are in Delta, it was 7 days, and in Omicron, 3 days. What do you say about it?
Because it is of this duration, it is believed by the WHO and other organizations that it is a far lesser virulent organism. The suffering seems to be not as terrible as we earlier witnessed. Patients are almost dying, and so it is a smaller, the clinical manifestations of a much milder variant.
And the patient's requirement for oxygen in Delta was 74%, while in Omicron only 17%.
Because the thickness of the secretion that blocks the lung and the vascular system of the alveoli is found to be far more severe in the Delta variant. Fortunately, some blessing is there, I suppose, because the Omicron variant seems to be much more milder.
Okay. Then hospitalization, they says that 69% in Delta is required, while in Omicron, 41% patients required hospitalization. What do you say about it?
Because now the outlook, therefore, from the medical fraternity is, as far as possible, try to manage at home. It is only when your oxygen saturation goes below the critical norm, or if you're having breathlessness, only then should you rush to a hospital. But today, looking at the crisis that we went through, most major hospitals are now well equipped with the requisite beds, oxygen, and I suppose, therefore, the suffering will not be as bad as what we went through earlier.
No, but doctor, I differ here, because as per the Delta, we had the peak was about 4 lakhs plus, about approximately 4 lakhs cases a day when it was a peak. While in Omicron, the projections which are being now projected, because yesterday only it was about 58,000 plus cases, and it's starting, and they says that about 2 million, about 20 lakhs people are going to suffer. And if we will take that thumb rule of 69% and 41%, now delta out of 4 lakhs, 69% works out to be about 2.75 lakhs people wanted the hospital bed hospitalization. While in Omicron, if let's although God forbids, but if it reaches to 20 lakhs, so almost 16 lakhs people, 20 lakhs, about 8 lakhs people would like to go for hospitalization. And we know that we don't have that much infrastructure in India. Don't you think that whatsoever easy we are taking of Omicron, but within next 10, 15 days, it is going to be a very, very heavy burden on the hospitals, on the medical fraternity, which we are not seeing right now. I don't know why we are not understanding one thing. What do you say about this, Professor Dr. Deve?
So the thing is, I do accept what you have said, that we are ill prepared for the terrible wave that will happen. We can only, sit and pray. May this not happen. These projected figures are indeed very scary. And the way it is going to happen, we will not have the requisite backup to manage this. We can only hope and pray. But as our interview unfolds, I will specify specific measures, which as a practicing clinician, I will absolutely guarantee this terrible manifestation should not happen. I will harp on that a little later.
Okay, we will come to that also. Then next is about the ICU admission. This data shows that 30% of the patients affected by the Delta required the ICU admission, while in Omicron it is 18%. Still, it is very scary because 30% of 4 lakhs is about 1.2 lakhs, while 18% of 20 lakhs is 3.6 lakhs. So it is more than double what we have seen in the peak of the Delta. So again, we don't have that much infrastructure in our hospitals in India, medical field.
Yeah, that is true. We only hope what it has been projected as statistically, we only hope it will not happen.
No, these figures which I am quoting is of South Africa, which they have done the thing for 1 month, first month, because November is started and December 30th is the data published in JAMA. You know the JAMA well. So it's an authentic thing. Then they say the ventilators. Here, we can say that safety is, we have some reprieve that Delta is 12% patients require ventilator, while only 1.6% in Omicron.
Perhaps that is a reflection of what is called the cytokine storm, which is absolute in the Delta variant and not as bad in the Omicron variant. So in Omicron, it is a far more milder disease. Now, it's much more milder. So patients do not have the requisite to go into an ICU and put under a ventilator and all that.
ICU, yeah. And then the mortality also, we have a reprieve that Delta 29% was the mortality rate, while in Omicron it shows 3%. But 3% is also not less, because if 20 lakhs patients per day and 3% of that is not a small thing, it's quite high.
These statistical figures are indeed quite scary. We can only pray and hope that such things will not happen. But today we have an emerging knowledge of how we can protect ourselves, and I will talk about that.
Now I would like to come to you. 2 questions simultaneously, and I want your answers straight. How dangerous it is, and what is the current treatment? Now,
Corona is a virus which, as an ENT surgeon, I have been dealing with for the last 30 years. The COVID-2, SARS-CoV-2 is a new mutant strain. We should look at what was my treatment right from the very beginning, which I initially advocated in my first interview. The virus enters the body. The body tries to defend itself. How does it defend? By putting forth a fever. When the body temperature increases by 1 to 2 degrees, viral replication stops, and then the body attacks it by its immune system. Now, instead of waiting for a fever, I still say the moment you feel an itch in your throat, the moment you feel slight congestion, slight headache, frequently sip hot water till you sweat. I've done that for quite a number of patients, and this is my first interview. I said, when you start sweating, it means the core temperature has gone up. And at that point, viral replication will stop. However, we have drugs which will absolutely arrest viral growth. What are they? Number one, doxycycline. Number 100 milligram twice a day. Ivermectin, 12 milligram twice a day. But today, there's a far more consensus on another drug which we absolutely neglected, and that is N-acetylcysteine. N-acetylcysteine is a mucolytic. It is an antiviral. It repurposes the immune system. So today, I don't give any of these other drugs. I only give NS the moment. I don't even wait for an RT-PCR because many patients are negative still. I only give N-acetylcysteine 600 milligram twice a day. By the second day, they become afebrile. Third day, all the condition stops. By fourth, fifth day, they're out of the suffering. So that should be the focus. Unfortunately,
can you, doctor, repeat the name of the drug which you are talking? It's just bit slowly so that our viewers will understand this drug.
Repeat again. This is life-saving. Sometimes, the symptoms may start late evening, middle of the night. You may not have this drug. Please stock it at home. Let me make it very clear. N-acetylcysteine, which earlier we gave as a mucolytic, means it makes the mucus less thicker. What is a major problem in a COVID patient? The mucus becomes so thick and strong and tough, it completely blocks the lung. What should we not do? We should not, when the oxygen goes, what should we not do? We should not attach a ventilator, pushing in oxygen, because that pushes that mucus plug further inside. 80% of the patients who are put on a ventilator die because we do not understand the exact pathophysiology. What did Dr. Tambo do from South Africa? He's a pulmonologist. He went into the lung and he took these thick mucus plugs. All those whom he treated that way survived. Now, because these mucus plugs are thick and blocks the lung, what should we do? Make it nice and fluid, which is a drug. I am not qualified or do not have the expertise to go into the lung and plug this mucus plug. I can give a drug that will make this thick mucus very thin. And what is that drug? I repeat again very slowly, N-acetylcysteine, 600 milligrams. It's a miracle product. The first
how many days and what is the dose of this?
600 milligram tablet. It is water dissolvable. So people have to put in water. It will immediately dissolve. Drink that. Absolutely harmless. Number one, it makes the mucus plugs thin. Number two, it acts as an antiviral drug. Number three, for those whose immune systems are not responding, for example, at an elderly age, it triggers the immune system. For example, in a police station, if the police are weak and sleeping, you give them a knock, they all wake up and then start attacking the terrorists. That is how N-acetylcysteine works. It triggers the immune system and allows a very powerful immune response. So that is the drug of choice we should think about. First thing, earlier what did we do? We gave remdesivir, we gave convalescent plasma. Today it's all gone. That era is gone. So people who are given also died. Whereas all whom I have treated with this drug, by the second day they become asymptomatic. By the third day, fever is gone. Fifth day, sixth day, they're absolutely normal. Later, we checked the RT-PCR, which unfortunately has been withdrawn from 31st of December. As you know, RT-PCR has been withdrawn. And at the end of 1 week, the RT-PCR negative also. Miracle drug, N-acetylcysteine, 600 milligrams.
So one is N-acetyl 600 milligram, one tablet a day.
One tablet twice a day for 5 to 6 days.
5 to 6 days. And one you said the doxycycline we have to take.
Earlier, all patients with corona, I used to give doxycycline and ivermectin, which an Australian doctor discovered. This combination makes people negative and afebrile in the second to third day. But today, based on my experience, I'm saying if you give in the starting of symptoms, give N-acetylcysteine 600 milligram twice a day, that is enough.
No need of doxycycline. Nowadays, even some doctors are for this Omicron. Some doctors are giving this Agitral tablet. What you say about that?
No, azithromycin, of course, is an antibiotic which prevents or treats the secondary infection that happens. But we also should be a little careful. All drugs have their side effects. 6 patients who, of course, I should be careful when I talk because I should be sure of what I'm talking. 6 patients who have been put on azithromycin have died due to agranulocytosis. It completely suppresses the bone marrow, and that's, we should be very careful about what we give. So therefore, azithromycin earlier we used to sort of promote, but not any longer.
So according to you, these drug which you are even saying about the drug, it should be the viewer or the patient should consult first the local physician and tell that this is the drug prescribed by Professor Dr. Deven. Shall I take it or not? Or he can take it himself or herself?
Well, any medication as self-medication is generally not advocated. And the problem here is, other doctors might not agree with my view. My view is based on my experience in treating people. I have treated, as you know, thanks to you, because of the initial interview, it went viral. Across India, people have consulted me. Earlier, my treatment protocol was doxycycline, ivermectin, and N-acetylcysteine. But as the time has evolved, I found that, this N-acetylcysteine alone is enough. The moment you suspect, don't wait for an RT-PCR because the corona symptoms are very clear. And if you suspect, absolutely harmless. It is absolutely harmless. You're not giving, actually, it's not an antibiotic, it's not a drug. It's almost more like a vitamin, this N-acetylcysteine. But it's a powerful mucolytic, which we as undergraduate have studied, but later on, it's completely disappeared.
Okay. So you have given a very prominently you are advocating and prescribing a medicine which is according to you it acts like a prophylactic, or you can say the initial stage of the. But what happens to those patients who already have are suffering from this Omicron 2-3 days past, whether they can have this drug or no?
They have to have, because why do patients die? Primarily, what is our great tragedy when they die? Such a small thing. The body shuts itself down because of the cytokine storm. And in that regard, N-acetylcysteine is the drug. Doxycycline, ivermectin will have no action on the mucolytic plugs. One doctor in America gave a steroid inhalation, which is also good, but we have a far more powerful drug here, which works like a magic. So we should we should give it the due consideration.
Are there any side effects of these drugs?
Absolutely not. Of course, there may be for any drug. This is a drug far more safer than anything else that we have got to offer.
Okay. Now, according to you, who are vulnerable in this Omicron? Although research says the young generation, but what is your experience? What you say about that?
So this thing is very clear. Everybody is vulnerable. Primarily, who are more vulnerable, for the last 30-40 years of my primary research as a postgraduate was on immunology. For the first time, I created the Pseudomonas streptococcal Klebsiella vaccines in the world with the help of my professor, Dr. Anandkrishnan. And in that regard, I found that if a person do not have the requisite amino acids are the backbone of the immune system, followed by iron and zinc. So if that amino acid is deficient, then a person is far more vulnerable. And that is where we need to take care. However, today's opinion about comorbidities of hypertension, of diabetes, of steroid therapy and all that makes a person susceptible. But what is the thing? Amino acids. I will underline that 100 times.
So according to you, amino acid plays an important role in there.
Absolutely, yes. Earlier, of course, as you know, we discussed a lot about zinc. But then there was a fear that is zinc causing the fungal infection? Is it bringing the fungus in? How many patients suffered as a consequence of that fungus? So sad when we see all this.
So amino acids we have to take from externally?
Yeah, now in that regard, let me make one thing very clear. The virus is a highly cunning thing which enters the body through a small little gap. Now that gap today we know is blocked by one amino acid, and that is called L-lysine. We don't have specific L-lysine concentrate drugs in the market. We have a combination of amino acids available consisting of all the essential amino acids which the human body requires. We can't manufacture them. So I will absolutely advocate taking one amino acid tablet every day. Does it have a side effect? Absolutely not. Does it vastly enhance the immune system? Certainly. I take it, I give it to my mother and anyone who comes. If you, so far, whom I've given amino acids, they have not got.
Can you just name the drug? What in which drug, by which name it is available in the market?
I do not know legally whether I have the permission to name, but by chance, if I, by chance it is not available, it is rather better we highlight it. Usually there are 3 tablets which I talk about: astamin fort, alamine fort, or alamine M fort, because it contains minerals. And then there is a drug called aminofit. These are all amino acid tablets.
And how many tablets one has to take?
One tablet a day. I am now, let me make it very clear that I do not have any vested interest, but I am now very clear. I tell people, please take an amino acid tablet till corona goes. There have been instances of families in which outside a relative has come with a corona positive. Earlier, the entire household will get infected. But my experience, I definitely will give the requisite strength to my experience. In that, I have found families who are taking amino acids, outsiders are coming, none of them have got infected. That is a documented evidence that I have.
Okay, and so one tablet a day, and according to you, till the time your corona goes, what are the side effects of this?
Oh, absolutely zero. Why? Because essential amino acids are required for the body to construct itself, which is why there is a saying called, if you break a mirror, you will suffer for 7 years. Why? The human body regenerates once in every 7 years. So in that regeneration process, we require amino acids every day. What is the source of amino acids? Sprouted grains. Didn't we earlier?
And how many mg we have to take?
It does not come in a milligram. It is just one composite tablet containing all the essential amino acids which the body requires.
And from which age one can take it?
I have given it to children, young children, 1 teaspoon a day. As young, whenever, after all, is there any problem in giving amino acid to a child? In the process of organogenesis, a child absolutely requires. So anybody, I will advocate half a teaspoon, 1 teaspoon, 1 tablet throughout till corona goes. You better be careful.
So according to you, there are 2 tablets one should take every day.
No, only one. Astamin fort. I mean, an amino acid tablet. Only 1 tablet. If it is an adult, 1 tablet.
No, the other tablet, the earlier one which you have given.
Earlier one, what is that?
That 600.
No, that is only when there is a corona positive.
But then okay. Yeah. When somebody feels itching or something, some symptoms. But this is a prophylactic tablet. It's just to prevent. Okay. Yes. Now, today, Professor Deven, we are seeing that about vaccine, lots of contradictory statements are coming. Somebody says that you require at least 2 vaccines. Or some says no, not even 2, you require a booster dose also. Now in that also there is different views. Someone says that booster has to be different than what you have taken the vaccine. So suppose you have taken the Covishield or Oxford Zeneca vaccine, you must go for a mRNA based either Pfizer or Moderna vaccine. What you say about this vaccine? Because people are not understanding one thing, whether this vaccine, if they are preventing, then why this Omicron is affecting those who have already been double vaccinated in India. Even booster dose, because in USA and UK, many people have got even UK yesterday, they have crossed 2 lakhs people a day. And UK is very, very small. One can imagine the UK is almost 1/20th time less than India. So if they have 2 lakhs a day, what will be the condition in India? But my question to you is, when they are vaccinated more than 80%, booster dose is also there, then why so much affected? Although mortality is under control, that we can see to it. Mortality, even with such a higher number of patients, their mortality rate is less than India. So what do you say about this, Professor Deven?
So the thing is, my views on this are a little controversial. Why? Because my primary research work as a postgraduate has been on vaccines and immunology. Now, my argument is, if you look at the life of planet Earth of the 5 billion years, humans have only appeared for the last 10,000 years or so. That is about 0.1 millimeter of the timeline of Earth. How many viruses have come and gone? Have humans perished? No, definitely not. Why have we succeeded and survived? because we are all immunologically strong. So my argument is improve your immunity. It is only recently when you look at the food pattern that we do not have the requisite nutrients to build up a strong, robust immune system. So all my colleagues have taken a vaccine. I have not. By my family and friends, they say, you have not taken a vaccine? Oh, no. If you have a very strong, robust immune system, your body will take care of it. Because how many patients who have had a vaccine, they have got infected? How many have got reinfected? And as a consequence, therefore, now there's something I'm about to say which might not be good. The booster dose gave Pfizer $24 billion. Are we in boosters? And how often are boosters going to be taken? How many variants are coming? And the newer variant, please know, there's something about to come called Lambda, and there's another one called Mu. These do not respond to vaccines. So are you going to again create one more vaccine for all that? No, we have to it's high time we think about immunology. If your person is immunologically strong, you don't have to bother. On top of that, you need to take the requisite preventive measure, which I will talk about shortly.
No, but there is a new variant has come called Florona, and then new has come in France the day before yesterday, which is also there now.
The France virus, it was discovered in a French hospital called IHL. So therefore, it is called IHL variant. So how many variants are going to come?
And this is that is having many variants and mutation in that.
Yes.
So what is now? My question to you is: if this is the situation, like influenza or flu, every year in US and UK, people are taking shots, taking the vaccine every year. While in India, only few people who are traveling abroad or those who are in a very severe condition, they take the flu shots, but not everywhere. Do you think that these vaccines every year we have to take, or after every 6 months, with a new type of vaccine to fight against the new variant which is going to come, or not?
Well, I am very clear on what I advocate. Absolutely not. When you're giving a vaccine, they're giving a very powerful antigen load. How much can the body sustain it? Doesn't the body have the required immunological system to sustain any infection? It does. So therefore, I am again very clear. Build your immunity than a vaccine. Protect yourself. You will survive. That is very clear.
No, but doctor, we are in a 21st century, and we know that everything is based on research. How many patients, or I will say, what is your basis of saying? Theoretically, yes, you have done your research at that time, but with this type of variant or the COVID virus, do you think it is advisable? Because what you are saying is contradictory to almost all top virologists as well as the WHO, where they says that the vaccination is the only solution. They even say vaccination, and they says that even the booster is required if we have to fight with this Omicron, if we do not want that Omicron should affect us. Now you are saying that you have not taken the vaccine and you do not wish to practice that people should take the vaccine. What is the logic behind it?
Because let me make it very clear. It is not that I am advocating against the vaccine. It is my personal opinion that I will not take it. Many patients come and ask me, can we take? I said, that is your liberty. If you want, you take it. But as an individual, I will not take it.
So viewers, I will make it very clear that these views which Professor Dr. Deven is expressing is his own view, and he says that he's not advocating against the vaccination. That is up to you, that you must go for vaccination. But what Dr. Deven is specifically saying is, if you increase your immunity, if you have a good immunity, then whether it's a Omicron or any other variant of the COVID, it will not affect you much because you already have an immunity system in place. That is what you mean to say.
I need to highlight on this a bit. Now, when I did my vaccine work, I developed the streptococcal bacterial vaccine for tonsil cases. And I used to give the streptococcal vaccine intradermally in the forearm for children getting recurrent tonsil infections. At that point of time, I looked at what are the basic ingredients to build up the immune system. There are several factors involved in that. Now, when I found the vaccine to be working in children with chronic tonsillitis, then I looked into what are the basic ingredients. And beyond a point of time, when I later emerged into my private practice, it is not so easy to construct a vaccine in my private setup. That I did in a medical college. So in the private sector, what did I do? All children who came to me, I gave them immune enhancing required drugs. And I found 100% of children whose immunity was increased did not have tonsillitis, did not have recurrent upper respiratory infections too. What did that show? It showed that immunity enhancement is the way to go.
No, but doctor, we would like to know one more thing about the vaccine. There are different vaccines are coming. Some are like Oxford Zeneca, then the Covishield or the Covaxin, and some are mRNA based. Everybody claims that their vaccine efficacy is more and it's effective, etc., etc. But the reports which are coming in Lancet are quite disturbing. They says the Covishield vaccines efficacy almost goes down after 3 months of the second dose. So it shows that every 3rd month or 6th month, we have to take the vaccine. That is one view. Although some studies shows that the mRNA-based vaccine like Pfizer and Moderna, they are doing well and their efficacy is still far more for longer duration than the Oxford Zeneca. And you are saying that if you have a good immune system, then you don't require the vaccine. Now, how a lay person or a normal person will come to know? Because today, again, we are in the face of almost going to be in lockdown. Weekly lockdowns have started. Night curfews are there. Till when? It's the 3rd day now, 3rd year. First 2020, then 2021. We were expecting after 2020, now we will have a good 2021. That also washed away. Then now we were expecting that 2022 will be very good for us. But the symptoms which we are seeing and the projections are coming that this will be this tsunami or this wave of 3rd wave, what we can say, will last up to April or May. So what is the solution according to you?
Because I run a clinic primarily as a preventive strategy, I have seen patients who I enhance the immune system for about 9 weeks. They remain symptom-free of any illness for about a year's time. People have recognized that protective effect. And year after year, I have families coming down. They say, sir, when we take your treatment for about a month and a half, about 9 weeks, we are absolutely, even children, when their neighbors are getting infected with the routine common cold, no infections. What does it show? That you must have a robust immune system, which today's diet does not contribute. So it must be given as tablets or syrup. That is my outlook. And that's I'm very clear. We need to be very clear. How many vaccines are you going to take? How much are you going to overload our system? How many variants are going to come? How many boosters are you going to take? I do not agree with these concepts.
So now my straight question to you is then what is your take on preventive strategies? What should be the strategy one should adopt now? Although this is the almost third year, 2 years we have discussed so many things about this vaccination, about the COVID. I still remember the first program which I did with you. At that time, COVID was in initial stage and you said, sip the hot water and it will increase the temperature and that become viral. And from that day only, I am sipping the water, hot water, and touch wood. Till now, it has not touched to me. The COVID has not come to me, but because I am not meeting people so frequently, but still, you don't know. My question to you is, what in the present scenario, in last 2 years, the things have changed. What is your preventive strategies to prevent Omicron or future variants of COVID? Professor Devin.
So let us have a very clear idea. The prime way in which I am not able to get the word, this intellectually designed thing called the Omicron, earlier the Delta, the prime way it enters the human body is only through the nose and mouth. Unless, of course, there is a perforation in the eardrum, and through that it might enter, perhaps. Perhaps. We earlier thought it might enter through the eyes, but no corona patient gets eye symptoms as the initial manifestation. They get a twitching in the nose, they get a runny nose, they get a sneezing, they get an itching in the throat. What does that mean? It is primarily entering through the nose and throat. In that regard, which area does that come under? It comes under my area, ENT. Now, what should have happened? I'm surprised and I'm distressed. 1 million cases in America and cases exploding here. As an ENT, we should have thought about it. And because that sort of was perhaps lacking, I said it's high time we understand the dynamics of the virus. It does not enter through the skin, and therefore wearing a PPE, when we enter a plane, they say you need to wear a personal protection equipment, that white gown we wear, and the shoe. No, all that does not make sense. Let me be very clear. The virus has a diameter or a size of 0.1 micrometer. A small molecule has a size of 0.0001 micrometer. So therefore, the virus is far bigger than a small molecule. It enters only through the nose. What should we therefore do? We should only protect the nose and mouth by a suitably designed mask, which an ENT surgeon should have done. I'm surprised when I did look into the mask design. Is there a mask in the market designed
for that, I will come to you now. But before that, you say one is mask wearing and one is the amino acid.
Yes.
These two things,
I only advocate only these two things. This is enough. We will survive.
And according to you, this this virus is entering only through nose and mouth. So if we are covering with the mask, proper mask, then the chances of getting infection is almost zero.
Zero, absolutely zero.
So now one more question, things which are coming nowadays is somebody is sitting along with you, means on your one side, and he's talking and you are talking facing front side, not to each other. Is still the chance of coming the virus into you?
Sir, I need to clarify on this one item called SSMMS antivirus filter. The antivirus filter through which a virus cannot go. If this is like a sieve in a whatever, the antivirus filter is something through which a virus cannot go. So if you're wearing a mask with a built-in antivirus filter, 100% you'll be safe.
No, but the virus goes when we are speaking. If we are sneezing, the virus goes in the straight, or virus go in the air.
It is an explosion out. But if you're protecting yourself with a mask, with an antivirus filter, it remains confined within the confines of a mask.
Now I will give you some figures which have come. This is a ACGIHS Pandemic Response Task Force. And the results published in spring 2021, the CDC expect the Omicron variant to spread more easily. Now, what they have mentioned is that a person not infected is wearing, if he is not wearing anything, he will be infected within 15 minutes.
True.
If he is wearing a cloth mask, he will be infected within 20 minutes. If he is wearing surgical mask, he will be infected in 30 minutes. And N95, if he is not wearing N95, that is 2.5 hours. I don't know if he's not, if it is a cloth mask, and if you are not wearing this 20 minutes, that is fine. The cloth mask, if you are wearing, then it will take 27 minutes. And a surgical mask is 40 minutes and N95 is 3.3 hours. And so what are your views about this? And they say it will take 24 hours for an infectious dose of COVID-19 to transmit between people wearing non-fit tested N95 respirators. If they are using tightly sealed N95, where only 1% of the particle enter the face piece, they will have 2,500 hours of protection. Now, my question to you is, can you tell us about the mask which can prevent Omicron? This is our topic also. Now we would like to know about the mask.
So at the outset, one thing I have to say, you have done an incredible amount of research, and I must tell you that your knowledge is far greater and more widespread than any doctor which I know. I'm really amazed, and hats off to the knowledge. Number one. Number two, let us have a look at surgical mask, ordinary mask, the N95. May I make it very clear that finally we have realized none of this will protect. And I've seen people wearing a surgical mask. There is a big gap. When they fold it like that, there's a gap. The virus can enter through that gap, or there's a gap between the mask and the eye. Today, the opinion is not about N95, but N99. But I am very clear. Does even an N99 have an antivirus filter? You must have an antivirus filter, because what are we doing? We are using a barrier to prevent the virus from entering. That barrier initially, Robert Redford, the director of CDC, what did he say? More than a vaccine, it is my thick cotton. Clearly, that alone itself is not enough. A thick cotton mask is good, but we need to have a thick 5-layer mask with an antivirus filter, which is what I have done. I sort of contracted with the company.
Yeah. So viewers, I would like to tell that Professor Dr. Deven is one of the very few, I don't know the others, but very few, as a doctor, he designed a mask to prevent the Omicron or any other COVID virus with his own experience and expertise. He designed, now he's going to show that mask, and he will explain why this mask is better than the other mask and how this mask can prevent the Omicron or any other variant which is going to come. Yes, Professor Dr. Dev.
So primarily, I sought my knowledge from the former director of CDC, Robert Redford, who very clearly said it is only a thick cotton mask. Later, we realized a 2-layer mask is not really adequate. This virus is so tiny, it can go through. And the emerging knowledge said it should have at least 4 layers, which is what I have done. I looked at the finest companies that manufactures masks. I got to the best of them. I asked them for a 4-layer mask, but then I realized it must have what is called an SSMMS antivirus filter. I incorporated that antivirus filter into this mask, and they have done a wonderful job, because I gave them the dimensions. I said, I've seen many masks, if you just cover just the nose and throat. No, it has to extend from the root of the nose to 1 inch beyond the chin. It has to extend from one ear to the other. Now, apart from that, it must also tightly envelop the face. So in that regard, what have I done is I've included or incorporated the lanyard, which is the string, right across. So when you tie it tightly, it is so tightly enveloping the face that what are the problem people face? That air will escape through that and fog the lens. Whereas when it completely envelops, it does not happen. And earlier, of course, I had incorporated a ear loop, but then quite often the ear loop becomes loose. It does not fit every face. And then I realized it is rather better to have a ear string, a lanyard string, which you can tie at any head, for any head. Some people say, oh, it's a little too big. No, it has got to be big. Why? Because you are protecting your own life. And after I manufactured, I gave it to countless people, well-wishers, doctors across India. Those who are properly using it, 100% they are protected. So I am saying very clearly.
Can you just put it and show us that how we can?
Yeah. So again, from the root of the nose to 1 inch behind the chin, this is called the tragus of the ear, from the tragus to the other tragus. I just put it across, and then I tie it like this, and I tie it like this. Now, when I do that, it so tightly envelops my face that even when I have for the glasses, even when I wear glasses, my glasses does not fog, and it is so nice. Many people, many professors, doctors to whom I have given this mask, they say it is the best thing that we ever got.
Okay, so according to you, but doctor, why no loops, ready-made loops? Why you have put this string?
Because heads come in various dimensions. If it is a loop, sometimes the head is a little small and it is not exactly fitting. or sometimes the loop becomes a little loose, and then the utility of the mask is gone. Whereas if it is a tying lanyard like this, it will fit. There are no many sizes. Patients ask me, is there a smaller size, larger size? No, there is one standard size which exactly will envelop the face, and a tying thread like this, a ribbon like this, will tightly tie it across the head like this. And therefore, I must say again very clearly, you are absolutely protected by. There are 5 layers inside this, 4 cotton, thick cotton layers, and inside there is an antivirus filter. Now, many people ask me, because it is so thick with an antivirus, will you sort of suffocate? Absolutely not. Now people say, this is one of the most comfortable mask. And what I'm saying is there a mask designed by an ENT surgeon where this virus is harboring? This is my area. ENT surgeons somewhere along the world or anywhere, such massive countries like America, they should have thought about it. But seeing no other option, I designed this. Whomever are using this mask, in spite of moving freely in the public or in major gatherings, nothing has happened.
Doctor, you being a doctor and that too of ENT, you are seeing patients day and night. Are you not wearing the face shield on that, or only you are wearing this mask? And
because I have aggressively advocated that the potential virus earlier could enter through the eyes, I was using a face shield. I was using shield like this, and like that. But now we realize eyes are not the portal of entry. It is the nose and throat. So if you're regularly, we can't be taking things easy and then while we're talking, remove the mask. No, if you want to even drink liquid, go to a secluded area where you are protected and then only remove the mask. You are protecting your own life. And therefore,
Doctor, you have made a very important point, because it was seen, especially when you are traveling in plane, that people are drinking water or even eating something, whether they are carrying their own food or they have to remove the mask. Do you think it is safe to remove the mask even during the flight at any given time, or it is okay because in plane you can remove it?
It is certainly a risk, because if there are infected passengers and it is an airtight capsule in which we are traveling and you remove the mask to drink something, we are certainly exposing ourselves. It is rather better you be, as far as possible, don't try to remove it. But if it is absolutely, you have to do that and you're feeling really thirsty, maybe you could. But we have not really come across patients traveling in a flight and got infected, and that's not really happened. So which means that to a large extent, people are protected.
Okay. Now, according to you, this particular mask is preventing COVID up to what percentage?
So it is I who have designed the mask, and we have had enough field trials, and as ideas and suggestions emerge, we have perfected it. So in this regard, if you're wearing the mask as you're supposed to wear it, properly, exactly, and airtight, you wear it 100%, because there's no way a virus can enter. Which, if a virus enters, we have failed. 101 million people infected in America, it means they have failed. They have zero knowledge on how the virus entered. They have not taken preemptive measures. They could have also said, wear a proper design mask. It is not there. If you look at various videos of American hospitals, they are wearing a surgical mask, or they are wearing a mask which is absolute. A person should not get infected if he is protected.
But they say that we are double mask in case if you are going to a high risk area. Do you think that double mask will help?
I have seen enough patients come to me wearing a double mask. These are ordinary masks, surgical masks, even a double mask will not give protection. We need to understand the virus size is 0.1 micrometer. Even a double mask will have enough lattices within for the virus to. You have to wear an antivirus filter, which I've incorporated. So I tell patients, instead of that, use one properly designed mask with 5 layers, 4 thick cotton, 1 middle antivirus filter with a tight tying lanyard. You will be protected.
But doctor, those who are suffering from heart or have respiratory problems, if they will wear such type of 5-layer mask, don't you think their oxygen intake will be not as good as without mask, and then definitely it will affect their health otherwise?
That is the prime reason why I made it out of cotton. This cotton permeates or allows the permeation of oxygen easily. This antivirus filter called SSMMS easily permits good breathability. So even whatever illness a person might suffer from, this absolutely will not hamper his breathing pattern.
So according to you, the breathing will be normal,
yes,
even if you are wearing 5-layer mask. Now,
yes.
Now, anyone.
No, I need to clarify. You said even if they are wearing 5-layer mask. No, even if they are wearing a 5-layer cotton mask.
Now, you have, as you mentioned, that you have given to on trial to many people, those who knows you, and anyone has been infected after using your mask?
Nearly 600 masks have gone out into the field, and I have asked all of them, because about all of them, public, doctors, the moment if anybody gets infected, I should know. So far, by the divinity and grace, not a single person has got infected. That is how we conduct field trials. That is how we will ratify the validity of a product. Even if one person gets infected, it means that there is some leeway, and that has not been addressed.
Now this mask is washable?
The design is such that one could wear it for 4 or 5 days and then wash it, and it can be washed 30 times.
You mean to say that generally the surgical mask, which is called another way disposable mask, people wear it and then they throw it whenever they come to the home outside. So this mask is not to be thrown, and one can use for 4 or 5 days.
Yeah, it can be used for 4 or 5 days. After that, one can wash it and then reuse it. And how many times can you wash it? 30 times. That is how powerful.
According to you, almost 4 months, one mask will work.
Oh, yes, absolutely, yes.
But when you are wearing a mask and you are not throwing it away, or you are not washing every day, so don't you think that your mask will, the COVID Omicron things are not going inside, but what about the outside? Will they be on the surface, and they will infect the others who are coming in contact with you?
Once you come back from your work, I'm removing the mask and keeping it in an area where others do not touch. Where my personal things, I keep it there. Nobody. So even if the virus was there over a period of 4 or 5, that everything has a lifespan. It will die.
So okay. Now this mask is costing how much?
So the prime thing is we need to realize it is to save the public, and not as a money generating item. And therefore we have priced it at the entire thing, including the lanyard, including the 5-layer antivirus filter, everything. It is priced at 50 rupees.
50 rupees for one mask, which can last for 4 months almost.
Absolutely, yes.
Doctor, you mentioned in one of your statement earlier that the Pfizer got this much money. Don't you think that you are also going to get lots of money by selling this product? So you are also can be blamed by someone that you are also making profit out of this COVID?
Wonderful. That's a good, I was anticipating. Now, well, sir, if ultimately what is the greatest wealth a person can have is normal health. Number one. Number two, of course, if the public realizes that there is something wonderful that they can protect themselves, they will buy it. Is there a profit margin? Yes. I have given it to a local medical shop. I have told them, you sell it. And when they sell, they will get a small margin in this. There will be an extra margin, which I have directed to be scheduled for a doctor fund. I'm so saddened 1,500 doctors are dead in this country. Have we created a fund for treating doctors? Not everybody, there are doctors who are doing well, but there are many who are not doing well too. If a person is pushed into the ICU, the minimum bill will be 3 to 5 lakhs. And beyond that, that SP Balasubramaniam, 1 or 2 crores. Who can afford that sort of money? So
So
I have direct...
you mean to say that whatsoever money is coming out of this selling of mask, except the dealer's margin which he is going to take, this money will go to a doctor's charitable trust, which will take care of the doctor's health,
Yes,
those who are suffering. So,
yeah.
so it means you are not going to charge anything out of this mask?
No, sir, because when we do something good, when I do something, that's something I tell my students. I'm a professor in medical college. I said, when you're doing something good without motive of profit, you are not filling your commercial bank, you're filling your spiritual bank. To do what? Number one, to have a normal, healthy family, caring children, long academic career or professional career, and a standing in the society. These are things money can't buy, are given to us by the good that we do.
Doctor, when this is such a noble thing which you are done, have you approached any of the service clubs like Rotary, Lions, etc.? Because yesterday only I have a district governor of a Rotary Club, Mumbai district, and he was saying that we are doing very active works wherever such types of activities are there. They are even dispensing this sanitary pads in the schools. They are putting the vending machines. They are giving the water wheels which can avoid the lady to carry the big heavy pots on their head. They can just pull the wheel. Even a man or a child can pull that. They are even printing the books, distributing, so that those who are the children, students can teach to the illiterate pupils. So they are doing. Why not this mask can go to in a very big quantity taken by service clubs, and they will distribute free of cost to the public at large? Have you ever thought about it or not?
No, I did not think about. Why? Because sometimes, when you give something free, people do not respect, value it, and use it appropriately. You must have that. I have paid 50 rupees and it is that much worth. Use it. Today almost when anybody can afford 50 rupees, let them pay that little money.
No, my point is not that. My point is free to those who are below the poverty line. There are many who cannot afford to buy even a 2 rupees or 3 rupees mask every day because their wages have been stopped. And now again, we are going to be entering in the same situation. Night curfews are on, weekend curfews are on. We don't know when we will have a complete lockdown. Those who are on the wages, daily wages, when their wages is stopped, how come they can afford? My point is two ways. One is, why not give this to the government? Let the government will buy in bulk. Whether they charge or they distribute, that is their problem, but they can do it in a bulk because after all, it's not that expensive as the vaccine. And you are saying that if you are preventing yourself, one can prevent. Even if after vaccine also we require some prevention thing. If this is what you have, and you says that because the real mechanism, real things, that how the virus goes inside, then it is the only way to prevent. Why not the government should take proactive once you approach them, and they will take by bulk. Let it be given to other manufacturers who can make it. You patent your design, get it done, and then let it become a public utility thing. What do you say about this, Dr. Devi?
That's a brilliant suggestion. That's a brilliant, wonderful. I know the local district governor of Bangalore, who, my good friend. Maybe I will approach him and tell him this idea. But my desire is a tiny amount, because we are spending crores and crores for so many things. Is there a fund for doctors who are not able to afford? There is, as of now. The other day, a politician came and said, by chance a doctor dies, we will give some. Doctor dies? What are you talking about? When a doctor becomes sick, they must have instant access. Like when you take an international travel insurance, every doctor should have an instant access. By chance, God forbid, in the pursuit of his duties, he gets infected. There must be a card which you can directly go to hospital, swipe it, and treat. I need that massive fund, which I don't want a single penny of, to be constructed in a bank under the governance of maybe the district commissioner, that doctors can utilize to protect, save, and treat themselves.
Why not? Why not associations like Indian Medical Association, which is very proactive? Why not they take up this thing, and then they have their own beneficial doctors beneficial funds? If they will take your mask and they distribute among all the doctors at least around India, because they have in lakhs of the doctors who are their members, don't you think that this mask can save lives of the doctors?
Yes. Oh, definitely yes. That's a wonderful suggestion, which I will approach the IMA and tell them if they want, they can do this.
So my point is, because you have designed something for the and you are not charging anything. This is something which people should learn the lesson, because everyone, whether it's a vaccine manufacturer, whether it's a pharmaceutical companies, many, and even we have seen during the COVID how the hospitals, few of the, I will not say all the hospitals, few of the hospitals become black sheep by charging 8 to 10 lakhs rupees or even crores, as you mentioned, money, and people have no other option to give. And you are one of the person who says, I have designed it, I am ready to give it free of cost. Free means only the cost of the manufacturing. Let it go, and whatsoever the profit is coming, it will go to the in their funds for the saving the doctors, which is a very, very important thing. Because if medical fraternity is not saved, then how the others will be saved? So it's a very noble idea which you have created. I'm sure that someone will definitely take it. And today is the president and the secretaries, all are very proactive of IMA, and they can very well take up the matter, do this. Now,
so in that regard, I need to ask you a question, because you seem to be very highly knowledgeable about. I am not aware of a mask designed by a doctor in the world. Are you aware of any mask?
No, as of now, no. But definitely, I would like to research whether a doctor has designed or not. But we will, even if somebody has designed, fine. But you have designed, this area, which is ear, nose, and throat. This is your specialty. And if you have designed it, and everybody knows that the virus enters from this. One thing which we have seen, and I'm sure that our viewers and even everyone has seen, people are wearing masks, but they are wearing masks here below the nose.
It is more a fashion statement. There is colored mask, designer mask. What rubbish.
We are seeing the mask costing few thousand, few lakhs of rupees. All these top fashion brands are manufacturing this.
Even in that, they want to corner the market and get a profit. So sad it is.
Okay. So according to you, Dr. Deven, first thing is wear mask, which you have designed. It means that mask which is really protect you from entering from the virus, which can enter either through nose or through mouth, which can see to it nothing can go, which is already having a filter inside that with a 4 layers of cotton and 1 layer is of filter. Is it correct, Dr. Deven?
Yeah.
And
4 layers of thick cotton and 1 middle layer of antivirus filter. And it is also having the strings, not the ear strings, but you have to tie up so that there should be no gap because of the different sizes of mouth. I just want to make it very clear, because even now there will be people saying that it is too big or it is not comfortable. I don't have a earlobe. No, I'm not willing to take any more suggestions. After a whole lot of suggestions have come, and we have finally come to this final design. And therefore, this is error-free. Now, once you've got a perfect product, we should not refine it anymore. Like in America.
But doctor, the thing is, today we have seen even children are getting infected. Yes. Now, this mask, as you say, it's only for one size mask.
Yes.
How a child of 4 years, 5 years, 6 years, nowadays the children are wearing from 3 years onwards. So whether this mask can fit to them or not?
Oh, certainly yes, because to a large extent, the child's head at around 2 to 3 years is sufficiently big enough for this to envelop. And the parents have to see to it that it is tightly enveloping the face by appropriate tying of this lanyard.
Okay. So according to you, this is a free size thing for everyone, whether he's a child or a senior citizen or anyone. Yes. Secondly, it is because it consists of cotton. It's a reusable, rewashable, and it can last up to 4 months, costing only 50 rupees. And it is having a filter inside. Now we have seen the filters, wherever filters are used, they are clean by taking out like an air conditioner. Do you think this filter is going to be there only, or you have to take out, or when you are washing, it will not affect?
No, it is completely sealed. The 5 layers are totally sealed by a circumference of lanyard incorporated into it. You can't open this. At the end of its lifespan of 30 washes, that life is over. You have to discard and buy a new mask.
Okay. Now the question will come, the doctor, when we are wearing mask, then why and you mentioned very clearly that PPE kit, that gown which we are getting in the flights or the people are wearing is of no use. Then why so much money is being wasted on that? Why the expert committees or the doctors like you are not telling the government that this has no role as far as the COVID is concerned?
For that, the government has to ask a team of doctors who are in the field, dealing with patients, dealing day and night. Has the government done that? Has the government, any government, have they called for doctors? Those doctors are willing to come and share your expertise. Please come forth. Has there been ever a call? No, it has not happened.
No, but doctors, they have constituted a task force in every state and as well as the center in the government, and all the task force are having the eminent doctors of their field. We have seen in the central task force is Dr. Guleria, the medical superintendent or the director of All India Institute of Medical Science. Then we have Dr. V.K. Paul, a leading pediatrician. Then we have many doctors everywhere. So doctors are already there. So to say that but whether those doctors,
those who wanted to volunteer, I certainly would have liked to volunteer. Have they called for doctors, please, who are ready to come and contribute, come over for a discussion? Has that happened? I'm not aware of it happening. And the task force does that include ENT professors who deal with this area? That also I'm not clear.
So you mean to say that the government, what government should do is, or the task force should do it, they should ask the doctors of different fields to give their inputs, and especially the ENT, because the virus enters from that side only.
Yes.
Sorry. Yes,
no,
doctor.
No. So you continue.
So I mean to say that only when the doctors, they will publicly ask the suggestions, and whenever the suggestions come, if they feel they can have a discussions, and nowadays because of the technology, you need not to go anywhere. They can do that discussion only on the Zoom or any other platform with you, and then they can implement, change the laws, see to it that things which are really correct, which can prevent, which is not that expensive, what we are undergoing can be tried.
Yes.
And it can be taken as a pilot project in some area to see whether it works or not.
Yes. I will, in this regard, give one example. How did Japan become so great? When America started losing to Japan, we discovered that Japanese were guided by one business management guru, and his name was Arthur Deming. What did Deming say? Go to the field, go to the end user, ask him if he's comfortable with the product that you have produced. Take his opinion, incorporate it, and bring out a better product. That is called Arthur Deming. Have we done that? We have not done that.
Okay. So according to you, first thing, one you mentioned about one amino acid tablet a day or after, and wearing this mask. Two things, if anyone will do, the Omicron or any other variant will not be able to impact.
India can come out of this pandemic.
Now, this mask is to be worn only when you are going out or even at your home.
If there are people at home, now I will tell from my experience that all those at home who are taking an amino acid, even though there are infected patients and relatives inside the home, they have not laterally spread the infectivity rate. It is not laterally spread. But we know countless other situations in which the amino acid is not taken. Amino acid L-lysine blocks the tiny gap through which the virus enters. If they're not taking, people at home are vulnerable if there are infected relatives within. If that is so, they have to wear a mask 24/7.
Okay. And according to you, one more thing which you have mentioned in our earlier program, which has become not virus, sorry, it was the sipping hot water. Yes. Do you think that still holds now also?
Absolutely holds. Right from the very beginning, if you feel, instead of waiting for the virus to manifest, by the way, virus is so called because the Latin word for virus is poison. We never could see a virus until the Germans invented the scanning electron microscope in 1932. Now, when the virus enters, if you feel you've got a slight running nose, nose block, sneezing, lack of smell or taste, immediately a flask of hot boiling water, take small glass of water and sip. Keep doing that till your body temperature increases by 1 degree. Till you start sweating. At that point, earlier, I remember, I believe great-grandfathers, if they got a bad infection, go sit in the sunlight. What do scorpions, when their arm is chopped off, what do? They go sit in the sunlight, absolutely normal healing. Don't animals sit in bright sunlight and heat up their body? They do. We need to take you from that, heat our body. If you do that in the first prodromal phase, 99% you will come out of it. Unless your immunity is so weak that the body cannot control this viral multiplication and it runs haywire. So hot water is the
what you say about the steam? Because people say that we are taking steam and sometimes...
I absolutely disagree. No steam. Hot water in a flask, take in like a glass you're sipping. Keep sipping hot water till you start sweating. It is only when your core temperature increases by 1 degree that your body will try to bring it down by starting to sweat. Now, if you do that for about 2 or 3 hours through the day, by evening, you're all right.
Or in the early morning, if somebody is doing exercise where they start sweating, that also can prevent the...
No. The exercise sweating is a different game altogether, because when the body is exercising, it sort of cools it down, but that is not enough. You need to put hot water in a flask, keep sipping hot water. It is life-saving, I will tell you.
And doctor, it was very prevailing in India about those Ayurvedic drink which we are taking in a different ways, and people were selling it. Do you also promote them?
No, I do not promote them at all. My idea in allopathy is very clear. There are specific defined ingredients to boost your immune system. What are they? Amino acids, primarily, iron, vitamin C, and zinc. Make sure that you have adequate amounts of it to immunologically be very strong. That is all that you need to do.
No, but these things which you are saying, we can't have it within our vegetables or fruits and the food.
We can have. What are amino acids? It comes from sprouted grains. What is vitamin C? It comes from fresh lime. What is iron? It comes from black grapes, black dates. And what is zinc? It comes from papaya and watermelon seeds. These are all natural ingredients. Do we take them every day? We do not do that. Look at the earlier vegetarian meals that we used to have, and so many varieties of vegetarian foods. Do we have anything today? Just some fried rice and chicken, maybe Coca-Cola as well. Does it contribute to your immunity? Absolutely not.
So according to you, a healthy diet is also very important.
Oh, absolutely, yes.
And for that, one has to take where these all minerals and amino acids, etc., are there.
Yes, indeed.
Otherwise, you have to take the supplement.
Yes, absolutely so.
Okay. Now, again, I am coming back to on your mask thing. Doctor, when you say that you are manufacturing and you have given to manufacture, do you have, or that particular party who is manufacturing, they have a capacity to manufacture? Because after all, we are a very big country with a population of 140 crores, 1.4 billion. Do we have that capacity to serve? Because the mask, when the first wave came, many people have started manufacturing the mask, and they have imported the machines and whatnot. But what you are saying about this cotton thing, is it manufactured on a machine or it's a handmade mask?
I sourced several companies and I identified one of them who's highly professional, whose products are of world-class caliber, and I gave that order to that particular party. And the way he is capable, he's got enough machines as well as the laborers to mass produce any amount that is required.
So basically, this mask, according to you, is manufactured on machines as well as
after the design, the cutting is made on machines, and then the lanyard incorporation is done by hand.
Okay.
That's how I suppose. I have not really gone to that factory in nursing, but we have had several discussions, and finally they have done a pretty good job. The very fact 700 plus people are using the mask so far, not a single case of infection. It means, of course, there are far more stringent lab tests that can be done, but we are running out of time.
So now, where this mask is available? That is the $1 million question.
Yeah. So what I have done, I can't be sitting and selling. So I have sourced it to one medical shop. I'm based in Mangalore, and instead of me sort of, the local near my shop where my one medical person, I have given it to him. And whoever I said, you sell it, you take your margin. One margin, you must go, translate that for a doctor fund. I'm very clear on that, and tie up with a bank, source it to the bank amount. I hope we can develop enough so that no doctor should suffer because of lack of funds.
No, why I'm saying, because our program goes across, not only across India, globally. So those who are watching the show, if they require this mask, where they should approach?
There is a medical shop by the name Pioneer Medical that is near the clinic where I practice. I have given it to him.
Okay, so okay. So, but the doctor, we definitely would like to say that those viewers who are interested in this particular mask, they can put their comments in any of the channels OTT platform, so that those channels can provide those messages directly to us, so we can forward it to Dr. Deven, and he can see to it that things can be supplied directly. Although please don't transfer any money till you will get a message directly from those who are selling it. And then only you can do it, because we don't want any money, and Dr. Deven also said he doesn't want money. So that is very, very clear. And viewers, I would like to tell one thing very clear. The views which has been expressed today are neither my views nor any channel's views. They are exclusively views of an expert doctor who's having lots of experience in his life as an ENT specialist. And that's why he has developed a mask which is sorry, I think some disturbance. So, Dr. Deven, can you hear me? Dr. Deven?
Yes, I'm here.
Can you hear me?
Yeah, I can hear you.
Okay. So, viewers, you can understand, you have seen today, and now you have understood that the mask wearing is very important to prevent COVID, and especially this Omicron, which is coming as a tsunami. But if you have a proper mask, a proper designed mask by a doctor, that mask which Professor Dr. Deven has given. So thank you very much, Dr. Deven. In the last, would you like to say something to our viewers?
You are the captain of your ship. You are the master of your destiny. In today's world, your life lies in your own hands. And therefore, it is up to you to protect yourself and your family. take the requisite precautions, make sure that you are healthy, and transform yourself, transcend as the years unfold. Have a wonderful, rewarding, wonderful life. Thank you very much. Wish you all the best. Take care.
Thank you very much, Dr. Deven, for enlightening all of us today about how the mask can prevent the Omicron, which is a very, very serious matter today. Thank you very much. And today's program has been live telecasted by V4 News, Global TV, V4 Stream, Malnadu TV India, Newsgaon se Samvad Sarokar News, Bharat Post News, Karu News, as well as it was shown live on Facebook and YouTube. And our endeavor to bring to you every day new topic. Tomorrow we are going to have a youth conclave on Central Reserve Police Force, and my guest is Mr. Alok Avasthi. He is the Deputy Inspector General of Police, Rapid Action Force, CRPF, New Delhi, and he will be giving answers to about more than 12 youths who will be asking the answers about the Central Reserve Police Force, that is called CRPF in India. Thank you very much. So thank you very much, Dr. Deven, for Professor Deven, for giving and enlightening all of us. And thank you all the viewers for watching our show. And I'm sure today's our thought leadership series has given you something to think and something to execute. Don't delay it, because prevention is better than cure. And we know that Omicron is not